Welcome to the Don't Feed the Fear podcast, where we dive into the complex world of food allergy anxiety. I'm your host, Dr. Amanda Whitehouse, food allergy anxiety psychologist and food allergy mom. Whether you're dealing with allergies yourself or supporting someone who is, join us for an empathetic and informative journey toward food allergy calm and confidence. Welcome back to the Don't Feed the Fear podcast, where here on the spring season, we are talking about things that we don't want to talk about. I'm trying to create a space here for the conversations that we tend to avoid, that we don't want to talk about because they're uncomfortable, we might not have as much information about, or we might be uncomfortable asking, and today's exception might be the peak of that. We are addressing the intersection of food allergies and physical intimacy. This is a subject that is sensitive, but it's very important for people who are navigating relationships with food allergies. Parents don't want to talk to their kids about it. Our kids don't want to hear about it, especially from us, but it's very important for all of us to know. I have two amazing guests here to help me with this conversation. The first is the expert on this topic, Dr. Scott Sicherer. He is the director of the Elliott and Rosalind Jaffe Food Allergy Institute. He is the chief of the Division of Allergy and Immunology in the Department of Pediatrics and medical director of the Clinical Research Unit. He is a clinician and a clinical researcher. He's written several books on the topic, the most recent of which is The Complete Guide to Food Allergies in Adults and Children. That came out in 2022. And relevant to today's conversation, he is a co-author of a very important paper that was published in 2006 in the Journal of Allergy and Clinical Immunology about peanut allergen exposure through saliva. So this was the first paper to explore and document what is happening with allergens left in our mouths after we eat, so that we could get an understanding of whether there is risk in kissing. So I'm so grateful to have Dr. Sicherer here to talk about all of his knowledge with us. Our other esteemed guest today is Sloane Miller. Sloane holds a Master of Fine Arts degree, a Master of Social Work degree, and a certificate in professional coaching, and she's a specialist in food allergy management. She is the author of the memoir, Allergic Girl, and she's the founder and president of Allergic Girl Resources, a consultancy devoted to food allergy awareness. She combines a lifetime of her personal experience living with food allergies with her professional expertise to connect with people about how to live safely, effectively, and joyously with food allergies. You can find her at allergicgirl.com. And it was Sloane's idea to have a discussion on this topic with Dr. Sicherer to explore the medical realities of food allergies in the context of relationships and physical intimacy, and strategies for communicating that understanding to our children and helping them to communicate them to the people that they enter into relationships with you. So I'm so appreciative to Sloane for the great idea and excited to share this conversation with you. But first, please be aware that this episode does contain discussions on sensitive and mature topics related to physical intimacy. Listener discretion is advised, and we recommend not playing this episode with young children present. So thank you, everybody, for joining us to listen. We wanted to record this panel conversation today for parents, for any providers who are curious about how do I talk to kids and young adults about safety and their food allergies when it comes to sensitive topics like relationships, dating, physical intimacy. It's a difficult topic. Sloane, you suggested that we do this, and I think you had a lot of good thoughts on why this is a really needed conversation.
Thank you so much, Amanda, and it's such a pleasure to be here with both of you today. And so what I'm seeing in my food allergy coaching practice, and again, that's also a self-selecting group, right? So I think there's much, much more going on out there that is just not choosing to come in to talk about this or is not feeling that challenged or having challenges privately. But what I'm seeing are these flexion points of the beginnings of intimacy and curiosity about romance and physical intimacy around teenagehood, young teenagehood, right? So late middle school, early junior high. And then this other flexion point around high school and early college, and then post-college. And what I've seen in my practice in terms of people coming to see me is delaying intimacy because there's so much fear and lack of clarity around real risks. What are the real risks from kissing if someone's eaten your allergen? What do I do? How do I have that conversation? Who has the information? And then as young people are turning into young adults, then how are you dating on Tinder, in your 20s and having this conversation? Will you be rejected by future people because, it's just too difficult? And certainly younger people are having those thoughts as well. But that's what I'm seeing overall, delaying intimacy because of lack of clarity around communication and what the real risks are.
Yeah, I agree. And I think what I see happen is the delaying intimacy based on this fear and not values. And then somehow an individual's personal values getting clouded with or shaped by their food allergies rather than what are my goals for my relationships and what are my values around age and timing of intimacy. So Dr. Sicherer, talk about your research, please, what you know and where we stand today with the science on this topic.
Well, first of all, let me thank you for the invitation to join and to speak about this topic, which is actually a topic that I'm a researcher, but I'm also a pediatric allergist. I see children, I see teenagers, I see young adults, I see some non-young adults. And this is a topic that does come up. And I bring this topic up at every visit, actually, with that age group. And I will have a parent leave the room if they want to, or if they don't want to, they can stay. Or if it's an 18-year-old or older, I will definitely have the parent step out of the room for this conversation. And I've seen actually that when I bring the conversation up, the parent is typically very comfortable with it, and the teenager may or may not be. But it is a very common thing, and I don't ever not talk about some aspect of this, usually about the kissing part of it. There's not a lot of research about exactly what the risks are, but like everything else with food allergy, part of it depends on the person's own allergy. If you're incredibly sensitive to trace amounts of a food, which is not the most common thing, the average person, for example, with a peanut allergy reacts to essentially a peanut kernel or more of peanut. So that, contextualizes things. I mean, not everybody is reactive to trace and, virtually like dust amounts of it. And, that's something to discuss with your allergist. But in a kiss, for example, if someone had been eating the food that you're allergic to, some of the food is still in the mouth of the person who ate it after they've eaten it. It will decline with time, but for some amount of time, it's there. If the kiss is on the cheek, and I actually give this scenario, I kind of change it to a grandparent scenario. So here's what I usually actually say to people. It's like, well, let's say your grandma had milk or your grandma ate peanut and then gave you a kiss on the cheek. Maybe your cheek will get red, maybe it won't, but I would not expect a severe allergic reaction from that. I mean, that's the typical, scenario I would answer. Is there someone who's super duper sensitive where a kiss on the cheek after grandma ate some peanut butter would be a problem? Maybe, but for the vast majority of people, it's either going to be a red spot or nothing. Many of my patients have had skin testing done. They get a bump where the skin test was. That's way more exposure than a kiss should be, right? So it's not something that should be a high risk scenario. Then I go on, and I don't take a break like that, but then I go on and I say, now, if grandma licked your eye, I don't know why grandma was licking your eye, but your eye would probably swell shut because that's sort of like an open area, and having your grandma had eaten some peanut or some milk or something and then licked your eye might swell shut. I wouldn't expect that to become an anaphylactic reaction. Is there an exception to that? Maybe, but that's not typical. But if kissing mouth to mouth and exchanging saliva, so some people call that French kissing or passionate kissing, then it's a different story, because now what they ate is in the saliva, and now the saliva is in your mouth. So basically the food is in your mouth, and then anything's possible. Depends on how much was left in there, and there could be even an anaphylactic reaction from that situation. So that's sort of my overview. You can ask me more questions about it, but that's how I get the conversation going.
When you age up to older kids and you're having that conversation about kissing or French kissing, my kids call it movie kissing. You've laid the groundwork that there is a possibility of a reaction that will range quite widely based on a lot of factors. How do you advise them to enter into that safely with the person they might be kissing, as far as time and how much is consumed and all of those details?
Sure. Well, there's two aspects to this. One is the idea that you have to be thoughtful about it. So there aren't a lot of studies on this, and the types of studies that are out there are not, super perfect at figuring out prevalence, but roughly 5 to 10% of people, older people with food allergies, report having had some reaction from kissing. And it was probably a surprise to them when it happened. They may not have thought about it until it happened. They may not have discussed it with someone before. It's usually not severe, but it could be, as we talked about. So as soon as I start that conversation with my sort of joking way of doing it to get the ball rolling, I think that, someone's already protected because they may not have thought about it before, but once they think of it, now it could be part of the process. And what that means, and I do bring this up as we talk about it, it means that you wouldn't spontaneously start, and I'll use the term, making out with somebody at a party who you don't have any kind of interaction with other than, hey, I'm going to start making out with you, because they don't know you, they don't know your allergies, you don't know them, you don't know what they've eaten. It's not a relationship situation. Now, I had long ago a patient say to me, boys want to kiss me, and they're going to do whatever I tell them to do for me to be safe for them to kiss me, right? There was no concern that it's going to be a relationship breaker or something like that to have to say, hey, I have allergies. This is going to be a little odd, but I want to talk to you before we would start, kissing. And so, again, not having a, in my day, it was spin the bottle kind of thing, but not having just, spontaneous kissing. But in a relationship, then your food allergy is known. And so then I could give the instruction, right, of what would you tell a partner who you're going to be definitely having passionate kissing with? What should they do to make that safe? And so part of the conversation is not having spontaneous makeout sessions. The other part of the conversation is, well, if you are going to be passionately kissing, what are the safety rules? And so this goes to a study that we did many years ago where we said, hey, let's pick a food, and we picked peanut. We had people who are not allergic to peanut eat a full serving of peanut, like a peanut butter sandwich amount of peanut, like 2 tablespoons, so plenty of peanut. And then we measured the peanut protein in the saliva over time. We had them do things like chew gum. We had them do things like brush their teeth, almost anything. So first of all, you could measure plenty of peanut in the mouth after you've eaten a peanut butter sandwich. So, the saliva does have peanut in it. It might vary person to person, but it's plenty detectable and plenty likely to cause a problem if I gave this extreme example of I just finished the sandwich and now I'm going to spit in your mouth. That would have plenty of peanut and probably cause most people to react who are allergic to peanut. However, with time, it dissipates. And we found that, chewing gum, rinsing, brushing, these are all things that brought the amount down significantly, and probably to the point where it wouldn't be a problem for most people. But sometimes for some of the people that were in our study, you could still pick up a little bit of peanut left. And so the thing that had the best outcome in terms of us not being able to detect the peanut in their mouth anymore was when they had not ingested anything else for a few hours and then ate a meal or a partial meal that had no peanut in it. And then we tested their saliva and we couldn't find anything. So it is the case that, chewing gum or rinsing out, brushing and all that stuff helps a lot, but the time period and also eating another food, why would that be? So, when you've eaten something, and this was, peanut butter, so I'm going to give you other examples, but, with peanut butter, there's going to be some between your teeth and it's going to leach out and, that type of thing. So sure, the chewing gum gets more saliva going, you end up swallowing more, there's more saliva being generated and getting swallowed. So it's a dilution process there. Rinsing your mouth, brushing your teeth, these are all dilution processes. And whether you have brushed your teeth well or not might be a variable, whether there was some peanut butter left over from the last time you used your toothbrush, all of those different nuances may be there. I think the reason that waiting that longer time is it just gives more time for things to dissipate. And then eating a allergen safe meal gives you more time to have things pass around your teeth, pass over your mouth, have more saliva come. So it's really a combination of physical movement and dilution effects. So that's what I tell my patients. It's like if so you're in a relationship, you're going to be, kissing passionately, your partner is best off not ingesting the food for a few hours and then having something that you also could eat that's safe. Now, questions that could come up if someone's thinking about this a lot would be, well, what if there's like a little kernel of a cashew stuck between their teeth that's going to come loose while we're kissing? These are all, nuances that, there hasn't been a study of every single food or every, type of food or every consistency of food. But I think, the general approach I gave you before about not eating it for a few hours, eating something else would probably solve most of those concerns, because you would have already gotten other food to knock out the food that had been there before.
Thank you for sharing that. A lot of kids then start to have, like you said, the specific questions about what if, and these outlying unlikely scenarios, like you said, the kernel stuck between the teeth. I know there have been some case studies where it is showing that it does happen, but can you speak to how rare that is in your professional experience and what you've heard from colleagues?
Yeah. So anything that's unusual gets a lot of press. And so there are lots of concerns, and, Sloane manages this as well. Like, there are families or individuals who have become, so with food allergy, and again, you have to talk to your allergist, and everyone is different, but for most people, casual exposure isn't going to be an issue. And what do I mean by casual exposure? I mean, I do have patients who are worried, like, what if my child touches a peanut? What if somebody breathes on them after they had a peanut cereal? These are kinds of things that people worry about. And it is important when you have food allergy to be cautious, right? Label reading is extremely important. Having a very detailed conversation in a restaurant. And I spend a lot of time in in my clinic talking about these topics. You could ask me to talk about them more. I'm going to stop myself from doing too much talking on those topics. But for the most part, that's where the energy goes, in getting a safe meal, doing a lot of talking, reading the labels every single time very carefully. But if you're worried that there might be something on a doorknob, or someone's going to breathe on you, or things like that, that's getting too far. You're going to a baseball game, someone, in the next row is eating something that you can't eat, and you're worried you're going to have an allergic reaction. For the vast, vast, vast majority of people, that is nothing that they need to worry about. And you just need to, talk to your doctor. There might be age-related issues. There might be, other aspects, but for the vast majority of people, those are not things that they'd have to worry about. So within that context, I wouldn't want someone to be, that concerned that they would be delaying having a relationship over this, or that they would not be having physical contacts of kissing, of sex, or anything else based on a worry like this. It should be manageable, and it shouldn't be high risk once you know the secret, so to speak, right? Like, if you don't know about these things and you hadn't thought of it before, that's where a surprise might come. But knowing about it, I think, is the biggest part of that. And I have, additional conversations about many topics of casual exposure. Like, I'm going, with a friend to the baseball game, or I'm going to be at a bar where there's, nuts in a bowl on the counter. All of these things, typically we're focused on making sure that what you're eating doesn't have the food in it, the protein in it. It's not seeing it from a distance. We did a study with peanut butter where, because there are people who report reactions, and anything is possible, and there could always be exceptions, but we took 30 children who were very strongly positive to peanut on testing, and whose families felt that they reacted from casual exposure. And we had them sniff peanut butter for 10 minutes. We rubbed peanut butter on them. But in this study, we did it in a double-blind, placebo-controlled fashion, where they didn't know, and the doctor didn't know, when we were rubbing real peanut or fake peanut, or when they were sniffing real peanut or fake peanut. And of the 30 children who went through this procedure, there was only one reaction to sniffing that was like breathing trouble, and it happened to have occurred during placebo. So they weren't actually sniffing anything. It was just nervousness. And in the touching part of the story, so we're rubbing peanut butter on their back, or we're rubbing not peanut butter that had some histamine in it to make it itchy anyway. And a third of the people who were rubbed with peanut got a little redness there, but that was it. And 2/3 didn't even get redness, because your skin barrier usually blocks that. Now, your eye doesn't do that so well, which is why I gave that example earlier. So, I use that information to just try to add some context. there are other situations where, like, if you're milk allergic and you're near like one of those machines that boils the milk, cappuccino or whatever. I mean, aerosolizing milk by boiling it can cause an allergic reaction because you're actually blowing it into the air. It's like someone with pollen allergy, it's in the air, it makes them sneeze and itch and can have problems. So it's not like food can't cause a problem through non-ingestion exposure. It's just that it's usually like more unusual scenarios, like boiling something, like if you're allergic to beans and you're over a pot of boiling, or shellfish. Like if there's just cold shellfish on the table, I wouldn't expect particles to be spreading around, just like they don't pop off with peanut butter. But if you're cooking shellfish, boiling it, frying it, or fish for that matter, then the steam coming off of that does carry protein and you could have symptoms. So I go through all of these different scenarios with people if they're asking and if they're concerned about it. And it's usually for people who are more reactive, because not everybody, like I said before, not everybody's super sensitive. And that question that you asked about case studies. So I think, most people don't recognize that what happens in the medical literature is if you see something unusual, you write it up and you send it to a journal and maybe they'll publish it. And those might collect. So if it's something that is like creating multiple of those, then you end up with case series. And then you might end up with like more and more information about it. But when things are pretty rare and unusual and grab media attention, you end up with a scenario where I think that what we usually think of as a case report. So an example of that would be many years ago, there was a bunch of reports about someone where it was labeled as the kiss of death. There was this teenager who kissed their boyfriend and died. And it made so much headline and everything. And then it caused a lot of, worry among people, which, it is what it is. But then like a long time after, it came up like, oh, this person had very severe asthma. It was not under control. It was an asthma attack and it had nothing to do with being kissed. There's a report of a death from oral sex where the giver had eaten peanut butter. And so the idea would be that exposure to the penis from the oral mucosa of the person who ate the oral surface of the person who ate peanut butter caused a significant reaction for the person that they were giving oral sex to. However, you could read that report and say, are we sure? There's one report like that. It seems like that person's, like I would have thought like that person's penis should have become incredibly like swollen and rashy, and that's never mentioned in the report. So I'm not saying it's not a true case. I'm just saying that it's such an unusual thing. It made it to the news. Have I ever had a patient ever say that happened? Maybe they wouldn't want to say it happened, but I haven't had anyone say it happened. When babies have reactions to foods, moms who are breastfeeding often say, well, I've been eating that food. Do I need to stop eating it? Well, a small amount of the protein that the mother is ingesting in immunologically intact form makes it into breast milk. But it's a very small quantity. And so that same baby who reacted pretty violently to peanut didn't react to the mother's breast milk. Or who reacted to egg didn't react to the mother ingesting egg and breastfeeding, even though there's some small amount in there. Are there case reports or reports of babies getting sick from the allergen that's in the mother's breast milk? Yes, there are. And there I would say is probably more reason to expect that there's some protein from the foods that the mother eats in the mother's breast milk to be there. Now, if we're going to start talking about sperm or ejaculate having the food that the person was eating in it, or if we're going to be talking about vaginal lubrication having the protein that the person ate in it, theoretically, yes, but the amount would presumably be close to not measurable. Drugs are not proteins because proteins are large molecules. Drugs are often not large molecules, and they get into juices of your body more easily than proteins do. So, for example, tears, right? Like if you have an eye infection, you usually get eye drops. It's harder for like a pill you take to help your eye. Actually, that goes for allergy too. I mean, when you take an antihistamine, it might help your eye, but not so much because it's harder for the drug to get into the secretions of your eye. But some does get there. And so, but those are small molecules. Proteins are harder to do that. So I see you have a question.
I do have a quick question. I just had an asparagus thought, just like a random asparagus thought, right? So if we're talking about both vaginal secretions and seminal secretions, there are many of us who eat asparagus, and then like the next time you pee.
Yeah, that's an organic molecule. It's not a protein. Okay. So similarly, it's exactly this. So thank you for that example, because it's the exact same theme. When you smell peanut butter, you smell a very strong smell. And a lot of people who are allergic to peanut get ill from that. I put it similar to a protective effect. Like if I came into a room with a gun and pointed it at your head, you're going to have a visceral response. You're probably going to shake. You might wet yourself, like anything's possible with that kind of fear, because you know that this is a dangerous situation, right? And then if I showed you, well, wait a minute, this is a plastic toy. What are you worried about? So yeah, there's a protective response when you smell peanut, but that's an organic odor that has no protein to trigger an allergic reaction. Now, getting back to this example with drugs, there are some reports of people having a reaction from body secretions where the person's body secretion goes to the person who's got the drug allergy, and they have some kind of response to that. So that, I would say, is incredibly rare, unusual, but it's more like likely than food where it's the protein has to get into these places. So it's harder for the protein to get into those places. But the example of breast milk is one of these things. So I would say that, we have not generally told people, oh, you can't, get sperm in you for like X number of hours since that person ate the food. Like that's not an instruction that we have, typically given people. Now you could say, well, gee, like, how do you know for sure that that's not something to worry about? I guess I would say, I don't know. It's, we did try to measure food protein in ejaculate before, and just can't do it because there's too much gunked up protein there to be able to use an assay on. But in real life, we haven't gotten this kind of scenario, and it seems like would be very, very unusual. The kissing is much more understandable. The food is in the mouth, and so it's it's not really it's not like it has to go through digestion and get processed, get to the bloodstream, find its way from the bloodstream to a secretion, and like there's so many extra steps there. So I think that that's just different. Now there are people who have allergies to sperm, actually usually the ejaculate fluid, not so much the sperm itself, and those allergies are also rare in and of themselves, and they are treatable. Either by using a condom so that there's not direct contact, or by doing a desensitization therapy, which is kind of an unusual one, the gradual introduction to the sperm. But that's a different kind of thing. It's not attributed to what the person has ingested.
So I want to, can we go back a few steps? Well, firstly, thank you so much for doing that original peanut study that basically all of us out here in the field are still using, and to help people understand. I use it personally. I use it with, my partner knows the study because he knows once he eats my allergen, that's probably it for the night in terms of kissing. He also has a beard, and and particles are transmitted through the beard to my skin. I have sensitive skin, and I will definitely get hives from that. So it's usually a shower and a few hours from that study, which was very, very helpful. So thank you. If we could go back to talking about spontaneity, because for young people, young adults, people in their 20s who are able to communicate, like that young person who was like, boys want to kiss me, and I will tell them what they need to do. Fantastic. Like that is an ideal conversation. It's like ideal, right? A lot of people are not like that. Of all genders are just not communicating that clearly. or they want to be spontaneous. And I get that question a lot too, about like how to be spontaneous. And my phrase for that is like, I can absolutely be spontaneous with preparation. So that's my version of spontaneity. How can we help young people feel spontaneous, and understand risk and understand what to do if in the tiniest chance there is a problem?
Yeah, I think there's a few things there. Kissing is not the only instruction I'm talking to teenagers about. We talk about alcohol. I always bring alcohol up, even when. So my joke on that one is like, whatever their age is, I say like, well, you've got 6 more years before you're legal to drink, but sometimes people accidentally get alcohol. And so, I open the conversation that way typically and point out that alcohol is a problem with someone who has a food allergy for reasons that the person doesn't think about actually. And so, the first thing that people probably think about is, well, there's some allergen in the alcohol that I have to worry about. But the bigger problem is that if you're one of the bigger problems is if you're inebriated, you might eat something that wasn't really safe because you just like are not inhibited. And you may not realize you're having a reaction. And on top of all of that, alcohol acts as what we call an augmentation factor or a cofactor. It makes reactions worse. It makes the protein get into the body quicker without as much digestion. And so it makes a worse reaction. I explain to people, like, if this much cashew is, ingested without alcohol, it's almost like you ate that much cashew with the alcohol. And so it's a worse reaction. And so, giving that kind of thing is also a spontaneity theme because, you have to think about where you are, what you're doing. And, as you said, Sloane, spontaneity, I could be spontaneous with some preparation. I mean, I think it's the same thing this way. So, like if someone is coming up to you, to give you a spontaneous kiss, you could say over here, you might have eaten something I'm allergic to, or let's just, elbow it since I have some allergies. And just like you're laughing about it now, the person who, is in charge, which is the person with the allergies, could make it like a laugh moment, just to lighten it. But, I don't think, one of the things I say is that your friend, like when I say to teenagers, so side point, right? Teenagers are at higher risk for fatal reactions, mostly because they may be less likely to tell a friend they're getting sick, tell a friend that they can't eat this, try to hide their issue, and then not use epinephrine, right? So with that in mind, I focus on, people that you're interacting with, your peers, don't want you to be sick. The last thing in the world they want is for you to start having an allergic reaction in front of them. That is what they do not want to happen. And they would be way more disappointed not hearing you speak up for yourself and let them know that you have the allergies and what you need done than to end up with a problem. And so, for you to say, hey, I'm sorry, I just can't find anything to eat here. I'm just going to have a Coke. Or to say, hey, I'm sorry, I know you wanted to give me a kiss and a hug, but how about an elbow today because I'm worried about whatever, they're going to be happier to know that, and to not have something happen. They don't want to be responsible for causing you to be sick. So I also throw that into my counseling.
It's also partners do not want to be the cause of sickness or witness something terrible happening. And so arming potential romantic partners with information, with real risks and real information. Also, here's my EpiPen. This is what to do in case of emergency is a gift to say, this is how to help me. And, it doesn't have to be a big deal, but there are real risks here. And here's what to do. And it's like it can be a 3-sentence conversation, which is one of the things that I talk about in coaching, is that this doesn't have to be paragraphs and paragraphs. It's really, you are in charge of you and your body. You know the risks. You know what you're allergic to. As long as you know you are letting someone in to that part of you, just in case, but also because no one wants to see you hurt your friends, nor a romantic partner. They really don't want to hurt you in any way. They want to be close to you and intimate with you.
I just want to add, I think that the way that Dr. Sicherer described having those conversations, the way that people receive it is the way that they will then carry it forward into being the ones to initiate the conversation. So what you modeled and described about starting young and adding piece by piece as kids get older is, I think, how it more naturally happens in relationships too, right? When people have had those conversations, then they would communicate differently and a less amount of information to a buddy on the basketball team with them than they would to someone that they were dating. So I think we model that in our conversations. And I think you set a good example of that, Dr. Sicherer.
Well, also even bringing it up about grandparent, because if we're talking to parents on this podcast about their young children and the parents are having, let's say, challenges with in-laws or their own parents accepting a child's allergy and saying, well, it's just, I just had a peanut butter sandwich, a little kiss on the cheek won't hurt. I think for parents to model that conversation, well, actually, there's some risk. It might cause some itching or some discomfort. And for even a child as young as 2 to say, what did you eat, grandma or grandpa or aunt or uncle? And teaching a child, and we talked about this, about body autonomy, right? That and agency. And the soonest you can get those conversations going about this is my body and this is my medical condition that I want to understand and know how to communicate, the better. And I think parents can model that conversation that they're having with grandparents for the child and help the child learn to advocate to adults around them, whether it's a teacher that wants to kiss them or a friend of the family, whomever it is. And they're like, no, what'd you eat? So,
Actually, your example moved the age group down. And so it is a conversation with, like when there's food around, a well-meaning parent who ate something and then blows raspberries on the baby's belly, is going to find that they're blowing some hives onto the baby's belly. Again, it may not be a serious, exposure, but it's still, is unsightly. And then it's like, whoops. And, as you mentioned before about the beard, that's another example where sometimes dads will, have something stuck, or for some reason, it's always the dads who are eating cashews and wiping their mouth on some towel in the kitchen. And then the towel is used to wipe something off the young child. And then they have hives from that. So those kinds of transfer of allergen, again, they're not typically severe reactions, but they could be, uncomfortable. And it does take conversations. We actually talk about ages and stages. And so, what we're giving, what I'm talking to families about for a baby versus a toddler who can grab food versus, the middle where they start to have more autonomy and they're, they have to be around more peers who are eating things and have, decisions about what they can control or not. And then the high school years where it's a whole other story, each of these ages and stages has its own things to talk about for managing allergies. So kissing comes up in a variety of age groups.
It does. And it's enjoyable. And people with food allergies should have and hopefully have a full range of wonderful experiences, including intimacy that is at the level and the safety that they want. And one of the takeaways that I'm hearing from you, which is great, is that the real risk of anaphylaxis, of going into really severe fatality danger zone, is really, really tiny. Right. And it's really an outlier. Did I get that correctly?
Right. I think you do. So you always talk to your allergist. There's always an exception. There's, people who are listening podcasts like this probably have a, more significant past history. So, but I think talking in the context of your own allergies with your allergist, but I still would say that on a epidemiologic basis, it's what you're getting in your mouth and eating is the most significant risk. And kissing presents the potential for that. Although, again, most of the time, even, any kind of simple, non-saliva to saliva kind of kiss is not going to have that significance of a danger.
And by the by, on a personal note, I have had a range of those experiences where I will have hives from getting a cheek kiss from someone who has dogs and touches their dogs and then touches their face. I'm allergic and asthmatic to dogs. Instant hives. I've had experiences where a guy, we had the conversation, very clear conversation. He understood my food allergies. He had eaten cashews earlier in the day. And I talk about this in my book. And we figured afterwards it was probably in his beard, but it had been hours. He had brushed his teeth. He had eaten something else. We'd had dinner together of a safe meal. And still I had hives everywhere and asthma. And again, luckily it didn't progress. And it was a mistake, even though we had had the conversation. And even though it had been a long time, that beard is
Yeah, beard is an extra scenario.
beard is an extra, and body hair is an extra scenario. However, again, it was an honest mistake. I had all my medications necessary. I did what I needed to do to stay safe, and we had it was a positive experience. It wasn't like he ran screaming from the apartment. He's like, "What can I do? What do we need to do?" And we figured it out. So I've had a range of those experiences, from saliva to beard. And I've had all the conversations too. And so I think the reason I'm saying this is because mistakes can happen, even when you are the most careful and you've explained the risks and you've had all the conversations. And that's why you have your anaphylaxis action plan. That's why you have all your medications. That's why you've spoken to your allergist about the real risk for you. And that's part of intimacy, is that sometimes things happen, and that's okay. And that is not something to be afraid of. But that's, I think, part of the normal part of anyone's intimate experience, that things happen that are unexpected. And as long as you are spontaneous and prepared, that you can have a safe and positive experience.
You used the word earlier, Sloane, that it's enjoyable. And I also think it's beyond that. To have close relationships is an essential part of the human experience and of having a healthy, well-rounded life. I certainly don't mean to say everyone must have a relationship. Some people choose not to, and that's okay. But for the most part, I think it really is central to our well-being, not just romantic relationships, but to feel safe and connected to people without this layer of fear and protection. And that's not really a healthy way to navigate relationships. So to find a way through that, I think, is really important socially and emotionally.
Yeah. The avoidance, certainly when I was a kid, and EpiPen didn't exist. Epinephrine existed, and epinephrine was given in the hospitals, but EpiPens didn't exist yet. So what I was told by the allergist was avoid your allergen. And if you have exposure, go to the hospital. That was what was happening in the 70s and early 80s. And what I did was I globalized that avoidance and ended up avoiding a lot because of my allergens. And that's what really prompted me to start my practice and write this book, because I didn't want to live like that anymore. I didn't want to live an avoidant lifestyle, and I didn't want avoidance to be my only coping mechanism. And to your point, that yes, this is part of being a whole human and having the whole breadth of human experience, and that we need more tools in our toolbox other than avoid. Of course, avoid your allergen, of course. However, as a global coping mechanism, there are other things that you can do.
Well, I mean, just to very briefly pick up off of that point, the past couple of decades, there wasn't much more out there other than avoiding and having a backup plan of epinephrine. And now there really are more conversations going on in doctors' offices, because there are possible therapeutics, whether it's an injected biologic like omalizumab or doing oral immunotherapy. And there's a lot more in the pipeline that's coming. There are other options other than just avoidance for people, for many of the people with food allergies, happily.
Yeah, which is very exciting. My son has done a combination of OIT and SLIT. And so these conversations for us, he's only 13, but obviously we start young and we talk early. These conversations are quite different because there's still risk. We're managing it. But as you said, it's so individual to each patient, depending on their history and what they've done. So back to the importance of their doctors talking to them about it. I love the way that you described that you do this. In my experience, this is not happening very frequently. No one's had that conversation with my son. A lot of my clients, I'm the first one to mention to them, what do you know? What's your plan? Please go talk to your doctor about it. What are your thoughts on that?
I think I'm like always have this conversation, and I know that the parents love that this is being discussed during their visit. So again, some kids might be embarrassed, especially starting around. I probably start doing around age 13, 14-ish. It drives me crazy when someone disappears for several years and then comes back and hasn't seen that, because I say like you should have a yearly visit. And what goes into the mind of many families is, well, like I'll skip a year for tests, and then they end up skipping 2 or 3 years because they're like, well, it's just the tests, and they don't remember that we talked for an hour. So it's like, well, tests are tests, but the discussion about the allergy is the more important part of the visit, in my point of view. So it gives me the opportunity to talk about all of these other things. And this is, I also talk about drugs. And I joke about that, well, not heavily joke, but it's sort of like there's drugs out there, and, that could also cloud your, ability to pick up the right food, or make you more hungry to eat the wrong food and then not realize you're having a reaction. So that only took 3 seconds for me to say, but like putting all of that into a package deal. I don't know what to tell you about. Every allergist doesn't cover it. There's a lot that has to be done in a visit, and there's a lot to talk about. I guess for a family listening to this, or a parent or anyone listening to this, to feel comfortable bringing it up with your doctor, not to put the burden of starting the conversation on the family instead of on the doctor, but the literature is out there, and it is part of most of our instruction forms, and it's in a sentence somewhere, almost everywhere that the doctors can see. But whether they find the time to do it, I guess, is the question here. So we the three of us could spread the word, and
I think for a lot of families, like I never raised this with my allergist, my pediatric allergist, my adult allergist. They never raised it with me. And I think there's probably an assumption like it's being taken care of elsewhere, like your GP or a pediatrician is doing it. Or so a question. So you're saying it's appropriate for families to bring it up. Now, if your allergist, your pediatric allergist, or your regular allergist, if you're an adult, doesn't know the answer, would it be your GP? Would it be like who has the information?
We're speaking about a niche area within allergy that, as you asked me, is this a common thing to be a problem? And among adults, 5 or 10%. So the majority of people who have food allergy maybe never thought of this, never experienced a problem with it, and never will. For me, who specializes in food allergy, it's a part of every visit that I have with a teenager, among other things that we talk about as for teenagers. So, all I can say is I wish it were a more open thing. If a listener said, like, where could I read about stuff like this? Probably, I don't know if your book has it, my book has it, it does, but, then you'd have to know to read more. At the Jaffe Food Allergy Institute, we do a monthly community engagement thing, like on Zoom or in person. Actually, tonight when we're recording this thing, we have a bunch of our researchers are doing a live presentation of our research work and what's out there for treatments now and in the near future. We similarly have these talks on exactly this topic. I do an Ask Me Anything kind of thing. So I think there are places, if you're interested in looking, you're going to find the information. If you're just paying attention to an occasional newspaper article that might be blowing things out of proportion, then the answer is talk to your trusted allergist about it. I do think that board certified allergists are the right doctor to know this information. And I think probably most of them do. They may just not have time to have this conversation or think of it when they're trying to teach when to use the epinephrine, how to use the epinephrine. Do you call 911? Do you not call 911? What about the label reading? I do spend way more time talking about label reading in restaurant. I spend more time than any of those other topics, because that's the trickiest part for most of my patients is through the restaurants. I could talk about that for an hour. So So I think, this might take back seat to some of those other things, and I don't think it should take back seat, but we are in sort of like a topic that maybe doesn't come front of mind to most of the families when they're in the office wondering, like, is the test going to be better this year? Or, what do I do if there's an allergic reaction? And they're not thinking about this, which, as we're admitting, is not the highest risk aspect of living with a food allergy, but is something that could be impactful on quality of life. I will say that in these conversations, the deeper questions, so to speak, the ones that are not just about kissing, so the ones that are asking about, oral sex and stuff like that, those typically don't happen unless the parent is out of the room. So I usually get the ball rolling with kissing and stuff while the parent's still there. And then after the parent's out, I'll say, do you have any other questions? And if there are other questions, it's usually what we already covered today. It's like, well, do I have to worry about sperm, vaginal secretions? And that's usually the next thought that people start to have.
I want to make just a quick plug for Centers of Food Allergy Excellence, because also, and this is my personal experience, I've had wonderful allergists, but they're allergist immunologists, and food allergy is not their specialty necessarily. And so I think if you can get to a food allergy center of excellence near you in the country, that will really support your family in understanding these issues and on a deeper level, as well as have an allergist at home near you that you can see. But
yeah, it's a good point. I mean, I would say that all allergists are trained to take care of food allergy, but you're right that it's not necessarily the focus for all allergists. And so, Food Allergy Research and Education, or FAIR, does have like this FAIR clinical network that lists about 50 places that are extra thoughtful about food allergy. And a lot of my patients actually have two allergists. They have me or my colleagues here at Jaffe Food Allergy Institute, and also their local allergist who maybe is spending more time with them for their hay fever or asthma. And then, they'll have their once a year visit for the food allergy. And there are a lot of things involved with a good food allergy evaluation. There's medically supervised feeding tests and a lot more talking and things like that. So yeah, I think your point well taken.
Do you want to leave us with any last thoughts?
I mean, for me, I think I've covered everything that you guys were interested in talking about, and I'm glad we focused on this area, which is incredibly important and probably under discussed.
I agree. Sloane, any last thoughts that you want to add?
Thank you. Thank you both. I'm so glad to see and hear and have shed more light on this topic. And I'm really thrilled that you bring this up with your clients and with your patients rather. And I would hope that this encourages more families to know that this is something that they should be bringing up to their allergist to explore it, that there is stuff to be explored here that's really good information and that your kids do want to know and will need to know as they age.
Thank you so much to both of you for taking the time to share your thoughts and your experience and your insights. I appreciate it so much.
Thank you for the invitation.
Thank you for joining us for part 1 of this 2-part series on food allergies and physical intimacy. Stay tuned for part 2 next week, where Sloane Miller and I will be back to dive deeper into these topics. Together, we'll explore how to apply the advice that Dr. Sicherer gave us in real-life situations, how to communicate it effectively with our children, and how to address the social, emotional, and mental health aspects of navigating relationships and intimacy with allergies. In the meantime, if you want to keep learning, you can read Dr. Sicherer's book, The Complete Guide to Food Allergies in Adults and Children. You can read Sloane Miller's memoir, Allergic Girl, and you can reach out to me for the free guide that I've created for you based on this series of talks to help you navigate these conversations and situations. You can access that by following me on Instagram at the Food Allergy Psychologist and messaging me asking for the free guide, or you can visit my website at thefoodallergypsychologist.com and reach out to me through the contact option. I appreciate you listening, and we will talk again soon. The content of this podcast is for informational and educational purposes only and is not a substitute for professional medical or mental health advice, diagnosis, or treatment. If you have any questions about your own medical experience or mental health needs, please consult a professional. I'm Dr. Amanda Whitehouse. Thanks for joining me. And until we chat again, remember, don't feed fear.